surgery, and I'm vice chair at the collaborative. We've got quite a few things to discuss today. Just to remind everybody that some of the meeting will be recorded. If you have any questions, if you could put them into the chat bar or raise your hand, and let's get started. So over to Karen first. So Karen's just going to go through a few important things to make us aware of.
Just hi everyone. Hope you're all feeling well on Friday afternoon and all that. Just a couple of quick updates really. We shared with you at the last forum that the annual report from the Federation had been produced. So just a quick reminder that it's available on our website. I've put the link in this chart, so when they all come out, feel free to have a look through. It's a reflection of things that have been done, obviously across the borough, and hopefully it gives you a flavour of some of the things we've been able to deliver. But I wanted to underscore that Dr. Farouk and I are really keen to come out and talk to practices about what priorities we should be having as the Federation going forward. So we're sending each of the practices a hard copy of the annual report with a letter inviting you to hopefully receive us, and we'll be following it up, hopefully coming out in person, or if not online, really just to get a feel for priorities and issues that you want the Federation to focus on in the year ahead. So just a quick update on that. If we just move on, Steph, the other update was just some events that are coming up through the next few weeks. Our roving team, which those of you may not be familiar, do an awful lot of outreach to support people who struggle to access mainstream services. And we've got a number of events that they're attending to do immunisations, health checks, diabetes checks and so on. And just if you've got people in your networks that you think might want to take advantage of those events, then 14th, 22nd of November, different outreach events, and there's a vaccine clinic at LBN that we're setting up, and we'll let colleagues know. And then we've got a particular focus for those with learning disabilities on the 16th of November, where we will be offering immunisations and health checks. So again, if you've got colleagues across your networks that you think would benefit from those opportunities, please do share it with them. And that's it from me, Arpana.
Great, thanks, Karen. And just to reiterate, please do liaise with the invitation from Dr. Farouk and Karen, just so that you can raise anything that you would like the Federation to help with. So please do take us up on that offer. The next item on the agenda is the MSK Digital Tool. Now, I'm sure colleagues will agree that a lot of the presentations that we're having in primary care are MSK related. So I think that this digital tool's really valuable to us. So thanks to Shanaz and Keith and Emily that are going to be talking to us about that today. So Emily, over to you.
Thank you very much. I'm not sure if we've got Shanaz here yet, but I shall introduce myself. I'm Emily, the Project and Engagement Coordinator covering the North East London project. And we've got Keith, who will introduce himself now.
Hi, good afternoon, everybody. My name's Keith Graham. I'm an MSK physio. I have been for quite some time now, and been working with Get You Better for a little while, developing the content and testing and making sure the app is all aligned to your pathways. Do you have the presentation there? Perfect.
Yeah. Don't think Shanaz is here yet, so we'll carry on.
Just crack on. Okay, excellent. Well, so thanks everybody for your time today. For those of you who haven't met us yet, we are Get You Better. We provide a digital self-management for all common musculoskeletal conditions across your area. Could have the next slide, please. Our aim is to better support patients in our healthcare system by connecting patients to their local MSK pathways and empowering them to safely self-manage across the whole patient journey. Behind the app is a team of MSK clinicians and industry experts who've worked in the NHS for many years and recognise the challenges facing primary care in the current climate. The app has been co-designed with both clinicians and patients. Next slide, thanks. Get You Better has been funded by your local NHS, so it's free for you to refer your patients to, and importantly, free for your patients to use. We use national MSK pathways that have been configured to each local area. The clinical pathways have been signed off and are regularly updated through a governance process with your MSK clinical leads. As the app is locally configured to each area and reflects how your patients recover across your healthcare pathways, it should be provided as part of routine care for your MSK patients. Next slide. Thank you. So the platform provides end-to-end support for patients to self-manage across the whole care pathway. Patients are initially linked to one local condition pathway, but they can get access to all the other conditions as and when they need them. The app is personalised, targeted and responsive. Information is provided to meet patients' individual requirements based on how they report into the app on how their recovery is progressing. For example, patients will get different information and advice at day 14 than at day 30, 60, 100 and so on. And that information is then tailored on whether they report their condition is improving, staying the same or getting worse. So it changes as they change. It links patients to their local support services, including health, social and public care services, as identified as important to your area by your MSK clinical leads. Next slide. So the locally configured musculoskeletal recovery condition pathways provided by the platform in your area are back and leg, neck, shoulder, hip, knee, ankle, elbow, tendinopathy and sprains and strains. Tendinopathy, rather controversially, also includes plantar fasciitis. That's a discussion for another day, but it is in there. I know that was one of the ones that I wanted when I was working as an FCP. Next slide, please. Oh, can we have the next slide? Thanks. So the service is for any adult patient requiring self-management support for a new, recurrent or long-term MSK condition, which we estimate makes it suitable for approximately 80% of MSK patients. It is not designed to support the patients who require targeted physiotherapy or medical management, such as ACL injuries, rotator cuff tear, inflammatory arthropathies. The written content for the app is in English. However, video subtitles are now available in 10 of the most common languages in the UK. And for the pub quiz aficionados, that would be English, Welsh, Bangla, Punjabi, Portuguese, Spanish, Urdu, Gujarati, Polish and Somali. We are also working on a touch-to-speech service, which is in development, which will expand the language support for all the written content. So next slide. So what are the benefits? Well, the benefits to a GP practice is a reduction in unnecessary GP and FCP appointments, a reduction in the need for physiotherapy referrals and therefore a better capacity at the physiotherapy end of things, and a reduction in the need for prescribed medication. We know patients commonly access the app after 6 p.m. and at weekends, so they feel safely supported and are less likely to go to ED or urgent care. One of the questions we often have about, are we going to send everybody to ED, is there has been some audit work done in Somerset, and the referrals to ED were found to be almost entirely appropriate. There was only one of the referrals which was not, and that was because the patient had answered a question slightly. I'll explain it when we do the screening part of this talk, but it's not going to overload the ED. For the patient, well, they have 24/7 access that supports their understanding of their condition, how to safely self-manage, and hopefully build habitual self-management routines. So we can have the next slide, please. So we want to take you through a typical patient experience. This is Joe, a 57-year-old who's had lower back pain for 2 weeks. Joe's off work due to pain and taking over-the-counter medication. Next slide. So how could Joe get the app? Well, Joe can self-refer to the app via a GP practice website, a QR code from a poster in the waiting room, via reception, or by e-consult if available. Some practices, when a patient books to get an appointment with an FCP or the GP, actually give out the app access from the reception level, so the patient has actually had the app by the time they speak to a clinician. So that's the self-referral route. Or Joe may speak to a clinician first, be assessed, given advice as usual, reassurance, medication, and so on, and then provided the app. And that could be done via any of the systems that you have for giving information. We know that practices with Accurex have a very high activation rate. You send a text which has the link which opens up, but it can be a QR code on a poster or a card, or again be directed to the GP practice website. The app can be downloaded from the various app stores after the patient has used one of the methods above to link the email. If somebody downloads it direct from the store without being linked, then it will not link to the correct GP practice. So at the minute that system wouldn't work. So it has to be from a link from yourselves. We are working to make that an option in the future. There's always somebody in every talk who says, I've just downloaded it and it doesn't work. If you go through a GP practice link, then it will work. The app can be accessed from a smartphone or through a web browser on a PC or laptop or a tablet. Next slide, please. Now we'd like to show you an example of the actual app content. So if you could click on that phone, there should be a video play button, please. On left, excellent. Yeah, perfect. So Joe's been registered to access the back pain app, and as you can see, there are access to the other conditions pathways as well. Once back pain is selected, we'll see the app for a practice loading with the practice logo at the bottom. Once in that chosen condition, there is a timeline that gives a high-level overview of the expected recovery journey. In Joe's case, from 2 weeks up to 12 months and beyond. Then we go on to the traffic light page. That enables Joe to indicate how they feel on a given day, and the content can then change to reflect that. Once in the app, the messaging is personalized and targeted, uses her name when it was relevant to the phase of recovery. There are biopsychosocial tips which can be scrolled through to give further support and advice. In the recovery plan, the content is specific to the fact Joe has had the back pain for 2 weeks and is feeling much the same. Provides information on what to expect. There's a number of clickable icons with information on this level of back pain at this amount of time. Advice on pain relief, what's good and what's not, avoiding opiates, using them for short amounts of time, all that information is in there. And lots of other topics relevant to this phase of recovery and lifestyle. There's support for return to social activities, driving and work. There's a large list of supportive advice videos with a range of advice on things like stopping smoking, sleep hygiene, and so on, losing weight. The exercise section has over 40 progressive exercises split into sections, which enables choosing the right level of exercise. If something's too hard, you can make it easier. If it's too easy, you can make it harder. The video has support on how to do these things. There is also some on-the-go exercise, which encourages people to do things whilst out and about. Joe experiences any new, changing or worrying symptoms, there's 24/7 access to the symptom checker, which will signpost to the appropriate service if there are any symptoms of concern, and that is available, as I say, 24/7. It can be used anytime and as often as she likes. Joe can monitor recovery with pain scores and pain diaries, if that's what she would like to do. There's a large list of local services supplied by your local MSK leads, where Joe can find out how to access local physio if that's how the referrals work, local physical activity groups, mental health support services, stop smoking services, anything that you're already using in your area should be in there. At any time, there's the option to click on I'm Better at the bottom there, and that traffic light will change all the content to provide preventative support, advice, and exercises. If there's ever a reoccurrence, Joe can access the early support she didn't see the first time around by putting in a new date of onset, and go back through the screening questionnaire to ensure it's appropriate to use this app, or otherwise be signposted the appropriate clinical service. Thank you. Next slide, please. So as shown in the demo, we safely promote self-management, but we will redirect Joe back into the system if needed. There are multiple layers to safety netting within the app. So Joe had to complete a screening questionnaire when first accessing the app. And there is also the symptom checker, which can be used at any time if anything changes or gets worse. Both of these provide direction to the most appropriate destination for review in your area, and that is as identified by your local MSK lead. So those choices are made at local level, they're not made by us. We configure the app to make sure that it reflects what your local MSK leads are recommending for your area. So, as I said, previous audit suggests ED attendance has been entirely appropriate, so the app is not going to unnecessarily overload the ED. If Joe reports getting worse 3 times in a row, this will actually trigger a questionnaire designed by the MSK leads to see if Joe's safe to continue using the app, or if they need a clinical review and by whom. So that's maybe for somebody who's gone into self-referral and is using it, but is getting worse, They're not just going to spiral onwards. The app will pop up and say, it'll check a few specific questions and maybe so you need to speak to a GP or an FCP or refer to physio. That's also quite useful. You know, when I was in a FCP, you'd say to people, see how you get on for 6 weeks and come back. But if somebody's getting worse and worse, a lot of people are quite stoic and will wait 6 weeks, getting continually worse. So the app will remind them that actually you've been worse 3 times in a row, you should probably be contacting us. And finally, your local area has developed questionnaires that trigger at certain time points in the app. For example, the start back questionnaire at 4 weeks, which if the patient stratifies as medium to high, will advise to book physiotherapy or see an FCP or GP, again, locally configured by your local leads. Next slide, please. We're nearly there. Do we have the next slide?
Sharing my end, is it coming up on everyone else's screen?
We've still got the safety. Oh, there we are. Based on the published and tracked benefits to date, signposting even just 1 patient per day can have significant benefits for the capacity of your practice and the capacity across the area. Next slide, which is the final slide. Oh. Basically, the final slide is just to get started. That's it. Follow the resources available to set up the platform in your practice. And Emily does that on a very regular basis and use the top tips to increase the uptake. And that, thank you for your time today for the presentation. And whether you have any questions, happy to take them. If we still have time. Sorry, I do go on a bit.
No, you're actually spot on. Thanks a lot for that, Keith. I think you were actually very informative, and I think a lot of your presentation covered all the sort of the questions or the queries that I had. Emily, can I ask, you know, in Newham, have you had a good uptake with the practices? How many practices have signed up?
So 16 practices are set up, and we've got 31 practices still to set up. So the way to do that would be to book in a 20-minute Teams call with myself, and then I can walk yourselves through it. Yeah, and we're very flexible, so if you send any like date and time, we can fit that in, and yeah, we'd be very happy to get you set up. So I'm just going to put that information in the chat here, and yeah, please do get in touch.
Yeah, and I think, Emily, you have sent out emails inviting practices, so
yeah,
if not, we can email Emily on the email address she's put in the chat bar. Was there anything else that you wanted to add? I know Shanaz has just joined as well. Thanks, Shanaz.
Yeah, no, thank you, Keith. Thank you, Emily. Sorry, I was late to join. I had an urgent call. But yeah, this app is really taking off. It's working very well. A lot of active patients on there at the moment. So I'm sure they're continually usually using some of the patients. They must finding it very useful. So, and recently we've had a lot more practices coming on board compared to previous few months ago. So it's a good time, I think, all the practices in Newham also, you know, join this app. The community service is also using this app to prescribe to patients who are waiting for physiotherapy while they're waiting.
Great, thanks. Prima?
Yeah, I was just going to say, actually, because I think our community MSK service is under huge demand at the moment, like most of the NHS. So I think if we can try and promote this as much as possible. We do know in Newham that's kind of more the younger cohort may pick up this first rather than the older presentation, which actually those that we refer probably more to MSK, but it's trying to kind of embed that in our communities as much as possible. So I think this would be really kind of welcomed for practices to try and share this with their patients as much as possible.
Yeah, and I'm sure Emily Cathan mentioned about the language compatibility. I mean, that was one of the reasons why we wanted to go with this app for this area specifically. So there's also, is there audio recognition coming up?
Type to speech is you hold on the text and it can convert into many more languages. Actually, it's interesting what you say about the youngsters using the app. I believe our most populous age group is something like 45 to 55 or 50 to 60. It's actually, and there is actually a decent take up in the over 70s as well. I think one of the very, very few benefits of COVID, not that as many benefits of COVID, was a lot of older people got online. They were given iPads by families. They were kind of, brought into the kind of the into the future, but connected. And so we actually have quite a decent amount of people using it in the older age groups. But the most popular group is my group, around the 50s. So yeah.
And it's true, you mentioned, because my mom, she's 70 almost. I only just recently registered her on the NHS app, so she's booking her appointment. And I just remembered that since you mentioned it, and I've forgotten about it. So same as me in this area, the demographics is as such that, our generation people, we have to promote it to the elderly. And once they know what to do, I'm sure they'll do the basics.
Yeah, there are some areas where it's used quite well in care homes, and the carers bring in the iPad, set it up, and people who don't have access in their care home actually are given access. It's kind of it's a relatively simple, straightforward thing to use. With respect to what you said about helping the physio referrals out. As a physio, if I was working in MSK, if somebody has had access to this information for a couple of months before they get to me, you kind of know that they're kind of informed as well, and you're not using that first appointment to do a lot of these sort of things. And we've had some areas where they literally scattered everybody on the waiting list. They sent it, and I think they had quite a large capacity drop off of people who then cancel their appointments. And I challenge you all, because the record uptake in the app in any one practice in the UK was basically one practice decided to AccuX every patient on their database, regardless of whether they had a report as an MSK condition at all. They literally just said, if you have a problem, have a look at this app. And I think we had like 1,100 in 1 week at one practice. And because they just went, well, let's just tell all our patients. Let's not wait for them to tell us there's a problem. Let's tell them. And, everybody's doing things slightly differently, but it's really cool to kind of hear some people like, let's just tell everybody that we've got it and give them a chance. Because a lot of people might not have engaged with their GP. I have a private practice. We have a lot of people say, have you spoke to your GP? No, they're so busy. Don't want to bother them. It's like, there's a lot of people out there who could use it, who aren't even in primary care yet. So
yeah.
Great. Thanks, Keith, and thanks to the rest of you. I think, does anybody have any other questions? No,
one more thing. I won't take up too much time. One more thing, I just want to let you know that we're going live with the public and patient launch in February. So that way, what will happen? Patient will probably come to you. So if you were not registered, they will come to you, and it will be done the other way. So, but before that happens, we want all the practices to know about it and understand and set them up. If it would help better that way. So yeah.
Thanks, Shanaz. And I think it seems like a simple process that once we've got it all set up, we could share the QR code on our websites. We can send an AccuX, and practices could even consider sending out a blanket message to every registered patient, because I think at the moment, as Rima mentioned, the MSK service is very overwhelmed, and there's a really long waiting list. And I think many of the patients that we're signposting or that are even referring themselves to the MSK service would be better helping themselves using the app.
Yeah.
Okay, great.
Yeah, we've got suggested wording for batch messages and things, and it's been really successful in some practices in North East London that have already done it. So yeah, like 600 patients when they just sent it to their MSK population signed up to the app. Yeah, with that one sent out. But yeah, thank you so much, everybody.
Yes,
for your
thanks,
time.
everybody. Nice to meet you all.
Thank you.
Thank you all.
Bye.
Thank you. Bye.
Bye now.
Okay, good. Have we got Fabio with us?
Yes, you have. Thank you for having me.
Hi.
Numbers being volunteered to tell you a bit about IMS. I was not really sure about the format, so I prepared some slides. Is it all right if I run them? Okay, I'm mindful of time, so I'll try to do it swiftly and quickly. And if you have any question, just shout out. Can you see my screen?
Yes, we can.
Okay, I'm trying to run the slides, but it won't let me. Do you see the normal PowerPoint, or you just see one slide?
No, so we can see your PowerPoint. It's saying presenting. I think it's just a bit slow.
Yeah. I've got all sorts of issues with IT, so I'll start. If there is any problem, we can try to work around it. I had something prepared using KEG data, but yesterday I received a package from our colleagues in the vaccination team. So I thought I'll grab what I could use, and I put it in a separate presentation. So you will see the dates of the data are slightly different. So this is a one day difference in the timing when they were collected. Nevertheless, they will be slightly different. We know that there are two different systems. One is Foundry and the other one is KEG. So looking at what's happening at COVID level for NEL, we have a few numbers here. I'm not going to bore you with everything. Chances are you have received already this package separately. It's important to see that there was a kind of deadline for care homes to be visited and all patients to be given the vaccination. And at the moment, we are at 98.43%. The uptake has been slightly lower than expected at NEL level. Nevertheless, there's been a lot of work into it. Different boroughs have worked in different ways, but we are at a good point. These labels are very faint to read, so the reason why I put it there is to see that there are two different local vaccination points that are Newham, Woodgrange, Liberty Bridge, and this is the top 10 vaccination sites for the week 30 October, 5 November. So well done. Yes. I can't see you while I'm presenting, so just say anything if you want to add anything.
Now, I'll let you know if anybody has got a question or a hand up. Don't worry.
Great. And again, that's still at NEL, sorry, this is a Newham level, just to see the uptake. Graphically, you will see that at risk is some kind of concern. The blue line, the tall line, is the eligible patient, and the vaccinated is in orange. So there is some work to be done there. And then we go in details for care homes. Again, the blue lines are the eligible and the vaccinated is in orange. Some boroughs are doing better than others. This is for healthcare worker declared. Unfortunately, the trend is what we expect. There is a lot of hesitancy there. I don't know what else we should be doing to try to convince healthcare to protect themselves and protect the people around them. Again, social care worker, same situation there. The way Foundry works divides cohorts in a slightly different way. So we have plus 80. And then 75 to 79. I'll let the graphs speak for me. I think it's easier on the eye. 70 to 74. 65 to 69. And again, at risk. This is the keg extract that I took on the 6th, and I've sent separately to the Newham practice managers. And again, these don't reflect exactly what we have seen previously. You will see some percentage are really off compared to what I said earlier. And I think there is like a difference in a week time where KEG collects everything. So despite the fact it's only 1 day from the time I collect the data, this doesn't reflect here. Nevertheless, it gives you an idea about what the rest of the places in NEL are doing. The usual suspects are doing a bit better than us. And as a graph, I put 3 cohorts are very close to my heart. So patients over 65, living in care homes, and housebounds. And this was COVID. For flu, I have a breakdown of the uptake divided by providers. I had a very interesting conversation with one of the practice managers a couple of days ago about the role that GP, primary care, have in vaccination. And I believe, you know, GPs should still be leading. They're doing a great job. It is good to see that looking at the graph, GPs are far, by far, the one are giving more jobs. So if you look at the first line, this is GPs and pharmacy below. So despite the fact that someone may argue it's easier to go to the pharmacy, just wait for their turn and get the job, GPs still play their role. And again, the message is always the same. There is an opportunity there to prepare for the storm, and with the opportunity to give the job, to run other things. And I know it takes time when you work on your lists and look at your patients. But I think in the long run, we really benefit your patients and the workforce in your practice. Again, uptake by eligible cohort in NEL. 65 is the first one, care homes. So you can see 67% of the eligible in NEL as a whole. Children is still quite low, at risk, etc. For children aged 2 to 3, you are the clinicians, so you know this better than me. There are certain cohorts, certain ethnicity that have a problem with the nasal spray. I had a very good conversation with Dr. Nakwi, Wax, and the outcome I get is it's up to the scholar, depending on the religion, decide if the nasal spray, because it contains a porcine gelatin, is appropriate or not for children. But you have an alternative, which is the job. So please, 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 when you speak to your colleagues that are looking into IMS, push the job as an alternative. It's better to have children protected rather than not. And we know how it is. They mingle between them. So if you go to the nursery, they come home. And then you, as a parent, you stop worrying about passing diseases to them and start worrying about them bringing diseases home and making you sick. Speaking about ethnicity, this is the current flu immunization uptake by ethnicity in NEL. Again, usual suspect, white British, seems to be the one that are more prone to get the vaccination. And there are others that are less happy to do that. I was speaking to someone and had a very funny feedback about the ethnicity, about how they go about immunization. So it looks like certain ethnicity, depending on what they think about immunizations and vaccination, they may decide not to have it. But then they speak to someone who's got the clinical training, and this will tell them, actually, you should do it. They change their mind. While other, regardless who's telling them, have made up their own decision and they won't take it. But again, when you see your patients for any reason, it's always good reminding them, if they are eligible, they should really take it. Quickly, this is the cohorts compared by national targets. I'm sorry about the fact that it's not really readable. I didn't prepare these slides and I couldn't change it. I didn't have much time, but we have primary school age children, 12%, secondary school, lower, 65 plus is the better one, under 65 at risk, and going on. So what is current immunization uptaken by borough? This is Newham again. Again, there are borough that are doing better than us, but it's good to have a look. So the grade, the school, again, pharmacy in green, and GP in blue. Again, this is to reiterate what I said earlier. GP, primary care, they still have a very important role when it comes to flu immunization. And again, Newham, where we are compared to the population, this is basically just to break down by cohort for Newham. Now, there was something that I was thinking about. I've been in this role for just a bit less than a year, and I didn't know much about immunization before that. Apart considering if giving certain immunization to my children when they were very little. But one thing I would like to bring here from my experience as an adult, very early in my life, I had a very brilliant idea to join the Naval Academy. If my accent doesn't transpire that I'm Italian, so that was the Italian Naval Academy. And we spent 1 year preparing to sail on a beautiful sailing vessel that was replicating a warship of the 1700. What I learned there was that no matter how much you like the people around you, there is nothing better than preparing for a storm or going through a storm together to make a team very, very strong and resilient. And also, there is never enough preparation for the storm. And as soon as the storm is gone, the best thing to do is to try to raise the morale of the crew and work together, because the next storm is just around the corner. What I'm trying to say here is that, for what I learn, every year we have always the same problems. The ministerial teams are slow in passing down the new campaigns details. Then they go to Department of Health and Social Care, they go to NHS England, and then they come to the ICP and the GP. By the time we receive them, we always have the same problem, i.e. courts like care homes and housebounds, and the rush to find the right provider to vaccinate them for flu and COVID. Children and parents that are not happy about immunization. I think this is a work we should do the whole year around. So when you see one of your patients stress, is your child up to their vaccination? Did they have the MMR and polio? And again, it takes time. You have got a limited time with your patients, but if this is done as a team and between PCNs, you can work together. you will be better prepared to the next storm. Now, we are having a very mild winter. Things will change, definitely. And there will be a lot of people sick, trying to get an appointment with you, running to the hospital to be seen. There is still time to be prepared and for them to be ready for the disease that comes. So my message is, it's been a tough couple of years. There've been a very few bad storms. You are a great crew. Try to work together. Please remember, vaccination is a very good tool to avoid that certain cohorts get really sick. Thank you very much. That's it. If you have any questions, I'll try
Fabio.
to answer as better as I can.
Thanks for sharing that data with us, and I think that really highlights, because I thought Newham was doing quite well, but obviously there's so much more work to be done. A few sort of take-home points, if I can just summarise. So with the 2 to 3 year olds, offer an alternative wherever they're able to get it, whether it's pharmacy, supermarket, GP, extended hours service in some hubs. I think we just need to be asking patients, encouraging them all throughout the year. So if somebody's seeing you and they're seeing you for their antenatal booking, tell them at that time that they will, would be advised to have flu as well as whooping cough, even if you are seeing them in April or June of the year. So these are all things that I think we are doing, but there is a lot of vaccination fatigue, and I think some patients are just fed up. But I think from our side, we can't get fatigued. I think we just need to keep carrying on. And I think the easiest way is to the patients that are wanting or that they've taken the vaccine the previous year, go for those patients first, because we know that we're going to have a different conversation with the ones that have previously declined. I've just got 2 things that I wanted to mention, and I have raised this before with our with the maternity services, but nothing's come out of it. So we still have patients where when they're seen, when the pregnant women are seen in the hospital, they're vaccinated by the midwife. Sometimes the midwife writes it into the maternity record. Sometimes we get an email. Sometimes we get a handwritten letter that's sent to the surgery with the vaccination details. The reason why I'm raising this is because I still have some women that I would have given them the flu vaccine. I've written it in their record and I've given it, and they come back a week later and they've taken it again in the hospital when they've gone for something else. So number one, this is a waste of vaccine, but then obviously, there's no systematic way that the hospital are communicating the vaccinations that they're giving there. Another thing is when the patients are having it within the pharmacy, there's some problem this year where some of the records haven't come through, but then we've been sent an email saying that these patients have been given the flu vaccine in the local pharmacy, but don't add it on to their records. We will send you information, or it will come through at a later date. But the patients had it beginning of September. I'm still waiting for that data to come through. So it's just knowing who to raise these issues with, because I think these are affecting it may be affecting the data as well.
I agree with you, Dr. Patel, that I share my frustration with my colleagues about the fact that we are in 2023 and there are apps free to use on the internet. I click and I will speak to you in English, click another one. My mouth will move like I'm talking in Japanese to you. And there will be a Japanese message coming to you with my accent. And I can't believe that we are in this age and still we have to rely on a provider to send you a handwritten letter for you then trying to understand what this says and enter into in your system.
Yeah, I think it just there's no systematic way where the hospital is communicating this through to us. I understand in other areas in London it's done through, there's some IT process where it integrates into the patient record, but we don't have anything like that in Newham. Just one other thing, and then I think we'll move on to Dr. Wax. Could we have the number for the school catch-up clinic? So could practices be given the number for any child that's missed their IMS in school? There should be a catch-up clinic, but we would appreciate a number that can be just shared with patients so that they can rebook themselves in.
So Vaccination UK has got a website that's easily accessible with telephone numbers. And my understanding is that they run the first clinic and then do the catch-up. I can find you the telephone number right now while we talk on Google.
Yeah, that would be good. So then we can just, because a lot of patients are coming because they've missed the school clinic.
But I wanted to add something, if you let me, because it's something I was supposed to share with you. Despite the frustration we all have, the issue with data is not just about prenatal services and pharmacy. I've got also the same issue with the Vaccination UK, who are sending practices the data for the vaccines given. And unfortunately, this is not a Newham problem. This is at least a London-wide problem, I think national problem. And then these emails get forgotten or left there, no one action on it, and the data are not updated. The central team has sent a couple of emails about how important is, as part of the core contract, that data are updated on each patient profile. So please, when you speak to your colleagues, if you have a person that is coding at the practice, or if the practice manager is doing the job, not to ignore those emails. Or if you have a new member of staff, they need to understand what to do, because possibly they don't know what to do with it. They leave it there and they forget. So when you receive those emails, and if you don't receive, again, I'll send you the email again, together with the telephone number for Vaccination UK later on.
Yeah, Wax has just kindly shared it in the chat bar.
Okay, sorry, I didn't see that.
Thank you. Okay,
that's very important. And sorry, Wax, he will always say something I meant to say in a much better way, so I'll let him speak.
Okay, Wax, over to you.
Yeah, I'm going to be a bit more positive than what the data shows. In the chat bar, I've actually put the data. Now, what you've got to remember is we've done this for 3 years, and short, sharp programs, phases of vaccination isn't great for the second biggest borough population in the country, so 500,000 people. Okay, if you have a look at that table, you can clearly see that we have almost the same number eligible as Havering, and remember, probably more than Havering, because we have a 12% more churn in our patients. Okay, so if you think about it, there's another 5% on top of that. But actually, in terms of raw numbers of boosters that we've actually given probably, I think it's the 3rd most or the 4th most, which is actually quite good. Now, what we've seen in previous phases is that Newham absolutely catches up, but it takes a lot longer because of the sheer volume. Okay. Also, you have to, when you look at boroughs like Havering, they have a very big elderly population, and Redbridge, so they're on a slightly different timeline to what we are in Newham. The Newham's relevant timeline is not October the 22nd, which it was for care homes, nursing homes, etc. It's not the 11th of December, which is the actual closure of the whole program. It's actually the outreach deadline, which is actually the 31st of January. So we'll be going at this till the 31st of January. The Newham approach always has to be slightly different. So not to be too despondent, I know the numbers are the numbers, but actually, if you look at the way that we're reading the table, actually we're doing okay. And we've only been going for 6 weeks, and that means 3,000 boosters in Newham, 3,000 boosters in Newham a week, across I'd probably say 2.5 sites and quite a few pharmacies. So that's actually quite good going. Okay. The other thing I would like to say is when you look at the flu, again, look at the raw numbers of flu that we've actually delivered. We're actually up there with Havering and Redbridge. And when you look back at this, we were towards the bottom of the pile last year. So actually there's an improvement. We're doing actually very, very well. The other thing that I'll put in the chat bar is I know Karen mentioned some outreach work that NHC are doing. We're also doing some outreach work, and I know I've reached out to some of the partners to talk about offering some vaccine at the practices to see how that would make a difference. Yeah, these are the dates, these are the times. We will be sending out some flyers and stuff like that, and we will be putting that on AccuBook so your patients know in these areas across the borough where they can come and get their vaccine. And we'll probably repeat that again in January if successful. Okay. And we're not just offering vaccines, we're working with LBN, and they're offering weight management. There's ELF supporting with talking therapies, Newham advisors from LBN, etc. as well. So there's lots going on. The other thing that I wanted to draw your attention is the PCN. And I know I've copied some of the PCN CDs into an email chain because we've actually been working with NHS England to identify specific PCNs of focus, and you can see the PCN graph. If you click on it, it makes it bigger in your MS Teams. But there are a couple of PCNs there in Newham that have a slightly lower down on uptake, and we've started to do some work with those PCNs specifically, and actually the numbers coming through the door from those PCNs have gone up. So when we get the next cut of data, we hope to have closed that PCN kind of gap. And then I've put the Vaccination UK. I know that Vaccination UK do a really good catch-up clinic in Vicarage Lane. They also do one in Woodgrange. I'm pretty sure that they may do some in other points in the borough. Do call that number. They're really, really good. I can guarantee you that all of those children in Newham schools that have not had their vaccine have had multiple texts, and their parents have had multiple texts as well. When I see them come into the practice, they say, oh, we want the injection. We were told by the school that there's a medical problem, so it has to be done by the GP. And then the other thing is often kids just don't want to have it in front of other kids, right? They want to have their parents there as well. So it's a longer journey from Newham. We will get there. We will catch up. In fact, we'll probably hopefully excel. In the months of November, December and January, we're putting in some focus kind of situation. It's interesting, though, I've already started to hear practices. Some practices say they've run out of flu, and some practices say that there's a lot of flu vaccine. It might be worth having conversations on the practice managers forums about sharing around some of that flu to get it where it absolutely needs to get to. That's all that I wanted to say, but happy to take any other questions.
Thanks, Wax. I'm just a bit mindful of the time because we've got we've been chatting away about the vaccine because I think we all feel so passionate about it that we're running very behind now. Fabio, just quickly, because we are running 10
seconds. I didn't mean to upset anyone. Wax, you know, I'm a big fan. You know that you guys are doing a great job, and I was just running the figures. What I wanted to say is that at the PM forum that Wax just mentioned, we discussed this. And I was surprised to hear some of the practice managers saying, "Oh, maybe we shouldn't do it," you know. And I was more concerned to show you how important your role is there in the immunization. That was it. Thank you.
Thanks, Fabio. Right. Is it all right if we move on to the next item on the agenda? Dr. Vijay Atharan, apologies for keeping you waiting.